দিচ্ছি তারপরে বাংলায় বলবেন। Good afternoon, viewers. Welcome to our 27th edition of Patient Education Series of Facebook Live from Shunetro Family Eye Care Center, Kolkata, every Wednesday at about 4 p.m. My name is Amitabh Biswas, and we have our usual team of Toshmita along with Toshmita. Would you like to welcome the viewers in Bengali?
নমস্কার এবং সাদর অভ্যর্থনা জানাই আমাদের সকল দর্শকদের। আজকে আমাদের ডক্টর বিশ্বাস অলরেডি বলেছেন যে 27th এপিসোড, এবং আজকে হয়তো আপনারা দেখেছেন ফেসবুক পোস্টারে আমরা দিয়েছিলাম যে আজকে আমাদের টপিক হচ্ছে আর ইউ অ্যাট রিস্ক অফ ডেভেলপিং গ্লকোমা। এটা নিয়ে বিশদে আলোচনা করবেন ডক্টর অমিতাভ বিশ্বাস, এবং আমি আর কথা না বাড়িয়ে সরাসরি ওনার কাছেই চলে যাব এবং রিকোয়েস্ট করব আলোচনা শুরু করার।
Correct. Say, we have already discussed about glaucoma in the past, and today is kind of, I won't say repeat, we are looking at glaucoma from a different angle, from the point of view of spreading awareness, whether certain people are at more risk of developing glaucoma or not. So we are going to discuss risk factors. But before we discuss risk factors, I thought it may be relevant to just understand or repeat the understanding of what exactly is glaucoma. So I have a small slide set with me. Let me see, I probably will have to share the screen, and where is the share screen? Share screen, and a little bit of patience with me, please. I'll share. Now, where is it gone? Are you able to see my title slide? Yes. Yes. So, are you at risk of developing glaucoma? As you mentioned, that this was the topic which we had posted on Facebook. And to begin with, as to what is glaucoma, I will probably say this, that the eye is a spherical ball closed on all sides, containing watery fluid or jelly-like fluid inside the eyeball. Now, just like any other ball, say for example a football or a tennis ball, this eyeball must have a certain pressure inside for the spherical body to remain intact as a sphere, plus also to facilitate the normal functioning of all the tissues inside the eyeball. Now, this pressure that exists within the eyeball, the normal pressure, can be measured from outside just as much. In a football, for example, we pump in air to create that pressure. Inside the eyeball, there is already existing fluid which has a certain pressure. The reason the pressure changes is because parts of this fluid is continuously getting manufactured inside the eyeball, and parts of the fluid are continuously getting drained out of the eyeball. If for some reason there is an imbalance of the equilibrium between the existing pressure within the eyeball vis-a-vis the threshold or the ability of the tissues to withstand pressure, particularly of the nerve cells of the optic nerve, then the optic nerve cells, which are very delicate, they fail to function properly or fail to even live healthily, and they die with increase of the internal pressure. This death of the optic nerve cells results in something called glaucoma. So glaucoma is basically a age-related progressive degenerative disorder of the optic nerve, where the nerve cells gradually get damaged. This is what is glaucoma. Now, glaucoma, as we know from our experience, and Toshmita, you will also know from your experience in the clinic setup, that every patient that we see, the ones who have glaucoma, they all ask the same question, the doctor, are we going to become blind because of this disease? glaucoma creates a kind of a fear within the mind of the patient. Unfortunately, the truth is that glaucoma actually can lead on to blindness, and that too, this blindness is usually of the irreversible type. But this will happen only if the glaucoma remains undetected and or untreated. If the glaucoma is detected early enough and appropriate treatment is initiated, then blindness can be prevented. Is this being followed by the viewers, Toshmita, or would you like to summarize it in Bengali for our Bengali viewers?
হ্যাঁ, আমি একটু দর্শকদের উদ্দেশ্যে বাংলায় বলে দিই যে গ্লকোমা অ্যাকচুয়ালি ডক্টর বিশ্বাস যেরকম বললেন যে গ্লকোমা হচ্ছে এজ রিলেটেড ডিজেনারেটিভ চেঞ্জেস অফ অপটিক নার্ভ। আমাদের যদি চোখের আইওপি ইন্ট্রাঅকুলার প্রেশার বাড়ে তখন অপটিক নার্ভের উপর প্রেশার ক্রিয়েট করে এবং এজের সঙ্গে সঙ্গে ওটা ডিজেনারেটিভ চেঞ্জেস হয় এবং সেটা গ্লকোমা হতে হয় তার কারণে। তো এক্ষেত্রে গ্লকোমা হচ্ছে যে অনেকগুলো ব্লাইন্ডনেসের কারণ থাকে, তার মধ্যে মোস্ট ইম্পর্টেন্ট কারণ ওয়ান অফ দোজ মোস্ট ইম্পর্টেন্ট রিজনস হচ্ছে গ্লকোমা। যে গ্লকোমার জন্য ব্লাইন্ডনেস হচ্ছে এবং সেটা কিন্তু ইরিভার্সিবল। যদি আর্লি ডিটেকশন হয় বা আর্লি ট্রিটমেন্ট শুরু করা যায় তাহলেই একমাত্র এটাকে রোখা সম্ভব, আদারওয়াইজ কিন্তু এটা লিডিং কজ অফ ব্লাইন্ডনেস এর মধ্যে পড়ে যায়।
Correct. Now, the other aspect about glaucoma is that everybody does not become blind if treatment is initiated, obviously, but we cannot reverse the damage that has already been done to the optic nerve, and any damage to the optic nerve will cause certain amount of disabilities in the quality of life in the life of the patient. And the most important among them is the disability or inability to move around freely or walk around freely in environment which is outside the comfort zone of known environments such as the home. Inside the house, a person more or less knows from years of experience as to where the furniture is or where the door is and where the toilet is. But outside the home, in different light conditions and in different layout conditions, a person can have difficulty. Because of the inability to see clearly in the peripheral visual field part, that is where glaucoma affects in the early stages. So, for example, when I look straight at someone, I can see the person's face, but I can also see a lot of things to my right side and a lot of things to my left side may not be as clear. I can also see a lot of things above my eye level and below my eye level, and that is what we mean by the side vision or the visual field. Now, this is what gets compromised with progressive damage to the optic nerve, and the person loses this side vision. Because of the loss of sight vision, a person is unable to correlate or relate the environment in one field. So, and that is what causes the inability or the disability of movement or walking around freely. Walking becomes slow, a person is unsure of the steps, especially so when a person is either climbing up or climbing downstairs. Because of the same reason of loss of peripheral visual field of vision, driving also can become difficult because a person may not be able to detect oncoming vehicles or even vehicles passing by from the sides or even pedestrians, and could land up with sudden surprise accidents. In advanced situations of glaucoma where peripheral visual field loss of vision progresses to involve the central field of vision as well, then the person may have difficulty in reading, writing, face recognition of even known people, and all the above symptoms can result in unexplained or severe kind of a mental depression in the life of the patient. This is the kind of a summary of the range of disabilities that can occur in the life of a glaucoma person.
ঠিক ডক্টর, এই প্রসঙ্গে একটু আসি যে আমরা এই যে গ্লকোমা, আমাদের তো অনেক রকমই রোগ আছে, যেমন ছানির সমস্যা আছে, রেটিনার প্রবলেম আছে, তো সেক্ষেত্রে গ্লকোমা নিয়ে এত মাথা ব্যথা কেন? আমরা গ্লকোমাটা নিয়ে এত চিন্তা করছি কেন?
Yeah, that's a good question, Toshmita, and I think this is the main purpose of today's session, to increase awareness about this disease entity called glaucoma, because in our society we have seen from our experience with patients that more or less even a semi-literate or a less literate person is aware of diseases such as diabetes or sugar ki bimari, chini ki bimari, or even blood pressure, hypertension. But very few people know that there can be an entity such as glaucoma which can result in blindness. So you see, I'll tell you a few statistics. The global prevalence of glaucoma in the 40 to 80 year age group is about 3.5%, which is a significant number. For the open angle variety, which is medically known as POAG, the prevalence is highest in Africa, and for the angle closure variety, we call it as PSEG, the prevalence is highest in Asian countries. The number of people estimated to be affected by glaucoma worldwide as of today is about 78 million, which is a large number, a very large number. And the estimated number of the same by 2040, that is in another 20 years, will be 45% higher to about 112 million. Now this 45% increase, the majority of the increase is perhaps going to be attributable to Asian countries. And the Asian country which is likely to have the highest number of glaucoma patients is probably India, less in China, and of course, other than Asia, the other continent which will be affected is Africa. So you can see, glaucoma is not a small problem, and because the blindness is irreversible, it is important, because blindness causes a lot of economic burden to the person, to the family, and to the society at large. I'm just coming to the economic burden. You see, economic burden can be measured as direct economic burden or indirect economic burden. Direct costings are cost of the hospital visits of the patient, cost of the travel to and from the hospital, the cost of the repeated tests that are done for diagnostic as well as for prognostic purposes as follow-up of the glaucoma progress or stability. The cost of the medications also adds up, and unfortunately, glaucoma medications throughout the world are much costlier than many other medications for chronic diseases. If a person's glaucoma is not well controlled with just medications, then if the patient requires other modalities of treatment such as lasers or surgical procedures, then the cost of that adds up. Indirect costings involve loss of the income or productivity from the resultant disability of the quality of life, as we mentioned earlier. The long-term cost of vision loss, of course, is huge. It cannot be measured with money. Cost of time spent by the family members adds up, because that much is the compromise they make with their productivity and earning capabilities. And overall, all these add up to a huge burden to the society. Now, because of all these reasons, glaucoma and the resulting blindness, it is of prime importance for the entire population to understand and become aware of the disease and the possible risk factors. Toshmita, I think if you can tell in
আমি যতদূর জানি ডক্টর, যে গ্লকোমা ট্রিটমেন্ট একটা লং টার্ম ট্রিটমেন্ট প্রসিডিওর, এবং এটা লাইফ লং, যেরকম হাই ব্লাড প্রেশার, ব্লাড সুগারের যেমন ট্রিটমেন্ট চলে, সেরকম গ্লকোমা ট্রিটমেন্টও লাইফ লং চলে। এবং সত্যি এটা একটা ইকোনমিক বার্ডেন। এটার খুবই প্রত্যেকটা ওষুধের দামও খুব, মানে ওষুধগুলোও খুব কস্টলি হয়, টেস্ট করতে হয় এবং ইয়ারলি ফলো আপ। সত্যি এটা একটা ইকোনমিক বার্ডেন। তো ইন দ্যাট কেস আমার মনে হয় প্রত্যেকটা মানুষের, আমাদের সবারই অ্যাওয়্যার হওয়া দরকার যে গ্লকোমা হওয়ার আগেই যে যাতে সেটাকে ডিটেক্ট করা যায় এবং অল্প থাকতেই সেটাকে যাতে অ্যারেস্ট করে দেওয়া যায়।
কারেক্ট, কারেক্ট। গ্লকোমা কোনো কিওর এখনো মেডিকেল সায়েন্সে বেরোয়নি। আমরা শুধু কোন রকম ট্রিটমেন্ট করে, সে ওষুধ হোক, লেজার হোক, অপারেশন হোক, ট্রিটমেন্ট করে আমরা শুধু সেটাকে অ্যারেস্ট করে রাখতে পারি যাতে নার্ভ ড্যামেজটা আর না বৃদ্ধি পায়। ট্রিটমেন্টের কথা, টেস্টের কথা, এগুলো আমরা আরেকদিন আবার বলবো। আজকে আমরা মেইনলি কনসেন্ট্রেট করছি on the awareness about glaucoma and the possible risk factors to understand that each person can understand whether he or she has these risk factors or not. Right? Yeah. So you see, because of this effort of awareness, the World Glaucoma Association celebrates a World Glaucoma Week over the last 10 years or so in the second week of March every year. That 1 week, the entire ophthalmic fraternity worldwide dedicates a lot of time and effort in spreading this awareness, spreading the message of glaucoma, and making people aware of the risk factors and the need for periodic checkup. This year's tagline for the World Glaucoma Week has been coined as "The world is bright, save your sight." And the dates are from March 7 to 13, one Sunday to Saturday. We will come back in the following 2 weeks to talk about other aspects of glaucoma. Today, we are going to talk about the awareness about the risk factors of glaucoma. At our center, Sunetra Family Eye Care Center, we have been doing this, celebrating or doing this awareness program in concurrence with the World Glaucoma Week over the last nearly 9 years now. And we have modified our strategy, and we extend the World Glaucoma Week to a glaucoma screening month throughout the month of March every year. So in the month of March, we welcome anybody, either our existing patient or anybody who's not an existing patient of ours, 40 years and above, with or without possible risk factors, to come to our center and have a basic glaucoma screening as shown in this handbill or pamphlet that we distribute in and around the areas of our center. So we measure the basic eye pressure. We do a basic examination of the glaucoma channels, a test called gonioscopy. We do a basic clinical examination of the optic nerve heads by ophthalmoscopy. And if and when needed, we also do a visual field test known as perimetry, specifically for glaucoma. This entire screening, we do it on a free of charge basis for 40 years or above, with or without associated risk factors. We'll come to the risk factors later. I also would like to emphasize that at our center, when we do a comprehensive eye checkup as part of a routine consultation, we do all these tests that are mentioned here for glaucoma screening as a routine test. So the eye pressure, the gonioscopy, the ophthalmoscopy for optic nerve, and if necessary, the visual field test. These are all done on a routine basis for all patients at every visit, not just first visit, at every visit. But the glaucoma, in the glaucoma screening month or glaucoma awareness month of March every year, we try to create a kind of a publicity about this among people in and around our center or from far away also. The people are welcome to drop by with prior appointment, of course, and come in for a basic glaucoma screening.
ডক্টর, তাহলে আমরা এই যে অ্যাওয়ারনেসটা যে করছি বা আমাদের এই অ্যাওয়ারনেসের জন্য আমাদের সেশনও আজকে করলাম, তো এটা আমরা কি কনভে করতে চাইছি আজকে স্পেসিফিক্যালি?
Yes, as I mentioned earlier, so we would like to spread the awareness that there is an entity called glaucoma, which, if not detected on time, can cause irreversible blindness. That is point number one. Number two, we want to create an awareness about the possible risk factors or causative factors of glaucoma. We'll come to the causative factors in the subsequent slides. I'll discuss that. So this is titled "What Causes Glaucoma?" You see, glaucoma can be classified in various ways. One of the ways of classifying them is into two basic types of primary glaucoma and secondary glaucoma. The word secondary, as the English word denotes, refers to glaucoma which occurs secondary to some precipitating cause, such as other existing ocular diseases such as uveitis, pseudoexfoliation. It can also be secondary to occurrence or existence of systemic diseases causing complications in the eye, such as neovascularization, resulting in something called a neovascular glaucoma, which occurs more so in diabetic people. There are certain drugs, such as steroids, overuse of which can result in occurrence of glaucoma. And glaucoma can also occur in an eye as a result of trauma, either blunt or penetrating trauma. So these are some of the important causes of secondary glaucoma. However, primary glaucoma, the one which does not have a precipitating cause as such, obviously has no specific known cause as such. The primary glaucoma, we do not understand and know any cause as of now. As of now, whatever understanding we have, although there are possibilities that it could have a genetic predisposition, it could have an immune response predisposition, but those are still in the experimental stage and not yet widely accepted in the ophthalmic fraternity. Now, there are certain situations which are considered to be positive risk factors for developing glaucoma. The, the most common and the important of them would be age. As we talked about, and as you also mentioned earlier, Koshika, that glaucoma is an aging degenerative disorder. So every person above the age of 40 or 40-year age onwards will have the possibility of developing glaucoma. Age is a risk factor. The other risk factor is gender. It has been observed that primary open-angle glaucoma occurs more among males than among women. People who have high glass powers, especially high minus powers, are more prone to developing glaucoma. And as I mentioned a little while back, that there could be a genetic predisposition. Persons who have glaucoma, who have a history of glaucoma in close family members, such as parents or siblings, are definitely at a higher risk of developing the disorder at some stage of their life or the other. Smoking is considered to be one of the possible risk factors for the development of this disease. It has been observed that primary open-angle glaucoma, or the POAG variety, is commoner among people of African descent than among the white people. People with systemic hypertension as well as hypotension, that's so-called low blood pressure, both such groups have a predisposition to developing glaucoma, as much as people with diabetes and thyroid disorders also have the same. As I mentioned earlier, use of certain medications or overuse of certain medications, either by need or otherwise, such as steroid medications, either taken orally or injectable ones, or by drops, they all can have a side effect of development of glaucoma. Chronic migraine has been seen to be associated with the development of glaucoma. Obstructive sleep apnea syndrome, or even that means people who have a snoring problem, may have an affinity to developing glaucoma. And last but not the least is the risk factor of a higher intraocular pressure, which obviously, if you remember the first discussion that we had today about the concept of glaucoma related to the eye pressure, so an increase of the intraocular pressure is a direct risk factor for development of glaucoma. Smita, I would like you to tell a small summary of these two slides in Bengali.
আমি এটা দুটো স্লাইডের থেকে এইটুকু দর্শকদের বলতে চাই যে সেকেন্ডারি গ্লকোমা অবভিয়াসলি কোন একটা সেকেন্ডারি রিজনের জন্য হচ্ছে, কিন্তু যেটা ম্যাক্সিমাম কেসেস যে গ্লকোমা দেখা যায় সেটা হচ্ছে প্রাইমারি গ্লকোমা, যার কিন্তু কোনো রিজন নেই এই জন্য হয় বা এটা না করলে হবে না এরকম কিন্তু নয়। সুতরাং এটা নিয়ে কিন্তু সচেতন থাকা সবসময় দরকার। ইয়ারলি চেক আপ যার জন্য খুব ইম্পর্টেন্ট, এবং রিস্ক ফ্যাক্টরস যেগুলো আমি মেনশন করে বলতে চাই, এজ 40 বছরের ওপরে বা 40 বছর বয়সী প্রত্যেকের একবার বছরে চেক আপ করানো দরকার গ্লকোমা আছে কি নেই এইটা ডিটেকশনের জন্য। অ্যান্ড যারা হাই পাওয়ার, যারা স্পেশালি যারা মাইনাস পাওয়ার, হাই মাইনাস পাওয়ার ইউজ করেন, যাদের ফ্যামিলি হিস্ট্রিতে গ্লকোমা আছে ডিরেক্ট ব্লাড রিলেশনে, মা বাবা ভাই বোন কাজিন যাদের আছে, যাদের গ্লকোমা আছে জানা তাদের, এবং যাদের সিস্টেমিক, যাদের ব্লাড প্রেশার সুগার আছে তাদেরও কিন্তু গ্লকোমা চেক আপ করানো দরকার বছরে একবার। এবং যারা স্টেরয়েড ড্রাগ ইউজ করে বহুদিন, বেশ কিছুদিন ধরে, যেমন সিস্টেমিকও হতে পারে এবং টপিক্যালও হতে পারে, সেই যারা স্টেরয়েড ড্রাগস ইউজ করে তাদেরও কিন্তু একবার গ্লকোমা চেক আপ করানো বা স্ক্রিনিং করানো দরকার, অন্তত ইয়ারলি একবার।
গুড। এই স্টেরয়েড ড্রাগের ব্যাপারে একটুখানি অ্যাড করে দিই যে দ্য কমনেস্ট ডিজিজ যার জন্য যাদেরকে স্টেরয়েড ইউজ করতে হয় হলো অ্যাসমা। যাদের ব্রঙ্কিয়াল অ্যাসমা থাকে তারা অনেকেই ইনহেলার ব্যবহার করেন, এবং অনেক ইনহেলারের মধ্যে স্টেরয়েড থাকে। বিশেষ করে যেসব ইনহেলারের নামগুলো CORT দিয়ে শেষ হয় তাদের সবকটাতেই স্টেরয়েড আছে বলেই ধরে নেওয়া যেতে পারে। এনিওয়ে,
তার মানে ডক্টর আমি বলি যে যেরকম আমরা সিস্টেমিক হাইপারটেনশনের পেশেন্টদের বা ডায়াবেটিস থাইরয়েডের পেশেন্টদের যেমন বললাম, সেরকম অ্যাজমা যাদের আছে তাদেরও ইয়ারলি একবার চেক আপ করাটাও প্রয়োজন, তাই না?
অ্যাবসলিউটলি, ইয়ারলি চেক আপটা তো হলো বেসিক। এবারে যদি গ্লকোমা ধরা পড়লো বা গ্লকোমার সন্দেহের কারণটা খুব জোরদার বলে মনে হলো, তাহলে হয়তো 1 বছরের আগেও ফলো আপ চেক আপের দরকার হতে পারে, কিন্তু ইয়ারলি চেক আপ মাস্ট 40 বছর এবং এই 40 বছর বয়স অনওয়ার্ডস একটা ইয়ারলি চেক আপ দরকার। শুধু পাওয়ার চেক আপ নয়, এই চেক আপটা হলো কম্প্রিহেন্সিভ আই চেক আপ, যেখানে শুধু পাওয়ার নয়, চোখের প্রেশার, চোখের অ্যাঙ্গেল, গনিওস্কোপি, চোখের রেটিনা এবং চোখের নার্ভ সমস্তটাই দেখে নেওয়া দরকার, যেটাকে আমরা বলি কম্প্রিহেন্সিভ আই চেক আপ। কারেক্ট? হ্যাঁ।
আচ্ছা ডক্টর, এই প্রসঙ্গে বলি যে আপনি তো বহু বছর ধরে গ্লকোমা প্রচুর পেশেন্ট নিয়ে দেখেছেন বা ডিল করেছেন, তো এরকম কিছু পেশেন্টের কেস যদি আপনি আমাদেরকে বা আমাদের দর্শকদেরকে দেখান যে যারা আপনার হাতেই গ্লকোমা ডিটেক্ট হয়েছে প্রথম, তারা জানতো না যে তাদের আদৌ গ্লকোমা আছে বা কিছু, তো এরকম কিছু কেস আপনার কাছে আছে?
নিশ্চয়ই আছে রশ্মিতা। প্রতি বছরে মার্চ মাসে আমরা যখন গ্লকোমা স্ক্রিনিং করি, তখন তো প্রতি বছরে মার্চ মাসে আমরা প্রায় 400-500 নতুন ব্যক্তিদের, যারা আমাদের এক্সিস্টিং পেশেন্ট নয়, তাদের তো গ্লকোমা স্ক্রিনিং হয়ই। এছাড়াও সারা বছর ধরে এরকম অনেক পেশেন্ট দেখি যারা হয়তো রুটিন আই চেক আপে এসছে হয়তো চশমার পাওয়ারের চেক আপ জন্য, বা এসছে হয়তো চোখে জল পড়ে বা চুলকানি হয় বা অন্য কোনো কারণে, দিয়ে আমরা দেখলাম যে হ্যাঁ গ্লকোমা আছে বা গ্লকোমা সন্দেহ রয়েছে। এরকম কেস অনেক হয়, অনেক পাই, এবং দ্যাট ইজ এনকারেজিং যে অ্যাটলিস্ট একজনেরও যদি আমরা ব্লাইন্ডনেস প্রিভেন্ট করতে পারি এই স্ক্রিনিং করে বা অ্যাওয়ারনেস ক্রিয়েট করে, সেটাই আমাদের সাকসেস। তো সব কেস তো ধরে ধরে বলা যায় না, তবে একটা দুটো কেস তোমাকে এখানে প্রেজেন্ট করে দেখাচ্ছি। একটা কেস ছিল যেরকম এই কিছুদিন আগে, বোধহয় বছরখানেক আগে, এসেছিলেন একজন 56 ইয়ার্স মেল, who had come to us for a routine eye checkup. He had a history of systemic hypertension, heart disease, and Parkinsonism. He also gave a history of glaucoma in his father. And when we examined his eyes, we found that his vision was perfectly fine, but he was using very high minus power glasses, power of -8. His intraocular pressures were measured by Goldman applanation tonometry, which is supposed to be the gold standard in measurement of intraocular pressure worldwide. By this method, his intraocular pressure in the right eye was 24 millimeters of mercury, which we know is more or less a borderline high, and in the left eye was 18 millimeters mercury, which is probably in the normal range. But then I would also like to mention here, for the benefit of our patients, that pressures of the eye do not have a defined normal value like blood pressure. So 24 could be normal for a person. 18, a pressure of 18 could be high for another person. It depends. It depends on other factors. There are other factors related to other parts of the eye, such as the cornea and several other issues, which we know how to examine them, and we are able to evaluate them. But the basic message that I want to give is that the pressure of 24 need not necessarily be considered high, it could be normal. And the pressure of 18 millimeters of mercury need not necessarily be normal, it could be high. Anyway, in this particular patient, the pressures were 24 and 18. I'll come to the discussion later. On further examination of the optic nerve heads inside the eye, we found that both the optic nerve heads in both his eyes appeared glaucomatous. I'll show a couple of pictures. This picture on this side shows a black and white photographic documentation of the optic nerve head, and we know by its appearance that the right eye, the glaucomatous appearance is significant. The left eye also, but not as significant as in the right eye. These are other specialized tests of for screening of glaucoma. We call this perimetry, or a testing of the visual fields. So testing of the visual fields is a measurement of the functioning of the optic nerve, and we see that in the right eye, these dark areas are the areas where there is probably a compromise of the visual field. In the left eye, the visual fields are nearly normal. I will not discuss the perimetry in detail here, because this talk is supposed to be for the layman, the patient. So I will not go into a medical analysis of this perimetry. And so much it's enough to indicate that there is possibly some glaucomatous change in the perimetry or the visual field testing of the right eye, and not such a remarkable change in the left eye visual field. So the point is, this gentleman had a few risk factors. His age was 40 plus. He had systemic hypertension. He had a history of glaucoma in his father. He had high myopia. The pressure, intraocular pressure in one of his eyes was borderline high. And with further investigations and follow-up, he was found to have glaucoma, and we had started him on treatment for glaucoma in the right eye. And as of today, his eye pressures as well as his glaucoma status are stable. So this is an example of a primary open-angle glaucoma, undetected until the routine eye checkup. There is another case I would like to highlight, Toshmita. This is of a young boy, an 18-year-old boy who came to us very recently from Bangladesh. He gave a history of excessive self-use of topical steroid eye drops over more than a year for itching. He used to have this ocular surface allergy problem, and the local doctor in Bangladesh had prescribed topical steroid eye drops to be used only for 1 to 2 weeks. However, this child never went back to the doctor. He just, every time he got itching, he would use that steroid eye drop on his own without realizing that what he is doing is wrong and can result in side effects from steroid eye drops, which he actually did. So when he came to us, his right eye vision was markedly compromised, much less than normal. And the left eye visual acuity, of course, was good. But when we saw him, his vision was already quite advanced compromise as a result of the glaucoma. We'll come to that. His intraocular pressures by applanation tonometry was 30 millimeters mercury in the right eye, which is definitely high. 30 millimeters mercury cannot be a variant of a normal, it is high. And in the left eye, the eye pressure was normal 14. His right eye optic nerve had appeared definitely glaucomatous, and the left eye nerve had a slight suspicious appearance, so he may develop glaucoma in that eye later. And this is a picture of the right eye optic nerve head showing much of the optic nerve head has undergone atrophy and become white, less white in the left eye optic nerve. And if you see this perimetry or the visual field test, you will understand that a major part of the visual field has got damaged in the right eye, less of it or none at all in the left eye. So this is what has happened. So which means in this entire area of the visual field, this boy is able to see in only this small white area, and that is his field of vision as a result of the glaucomatous damage. And in this case, the only risk factor this boy had of developing glaucoma at a young age, he's not 40, he's only 18, is excessive use of topical steroid eye drops. And the side effect of this eye drop resulted in a high pressure and glaucoma. So this is it. So this is the essence. These two cases probably indicate the importance of periodic eye checkup, as Toshmita mentioned. So if there is a risk factor, the commonest risk factor being age, so everybody from age 40 and above must have a annual comprehensive eye checkup. And if there is any other risk factor other than age in this particular young patient, the risk factor being excessive use of topical steroid, if this boy would have had a checkup earlier than this, maybe the vision loss in the right eye might have had been prevented. This is it, Smita. Have a look.
আমি একটা পয়েন্ট খালি আরেকবার একটু দর্শকদের জন্য মনে করে দিতে চাই যে অবশ্যই কোনো ডক্টরের কনসার্ন ছাড়া বা প্রেসক্রিপশন ছাড়া এভাবে কোনো মেডিসিনই লং টার্ম ইউজ করা একদমই উচিত না। তো যদি প্রবলেম হয়েছে বা হয়েছিল, ডক্টর হয়তো কখনো দিয়েছে ড্রপ, তো সেটা আরেকবার কনফার্ম করে তাহলেই ইউজ করা উচিত, না হলে কিন্তু অবশ্যই নয়, যেটা আমি শুরুতে বুঝলাম।
Correct. And for the same reason, Toshmita, for bronchial asthmatic patients who are on steroid inhalers for years on and on, they must have a periodic eye checkup as well. So, having spoken about the problem of glaucoma, the reason why we need to create an awareness, why the World Glaucoma Association is trying to create awareness all over the world, the problem, the quantum of the possible problem in our own Indian subcontinent in the future, we will now summarize a few points that glaucoma is actually the second most common cause of blindness worldwide. The first cause is, of course, cataract. Cataract blindness is reversible. One can undergo a cataract surgery and vision can be restored. Glaucoma results in permanent damage to the optic nerve, and the blindness or the vision loss cannot be restored. Point number 2 is that the prevalence of glaucoma seems to be on the increase worldwide, especially in the Indian subcontinent, and over the next 20 years, the projected figures are a little bit scary. So we must create awareness, governments must help create that awareness among people. The economic burden of glaucoma is huge, not only for the individual, also for the family and for the society at large. Blindness from glaucoma can be prevented if the glaucoma is detected early enough and appropriate treatment is initiated. Next point is that glaucoma is an aging degenerative disorder, which is also associated with several other risk factors. And it is our effort to create an awareness of those risk factors and the possibility of glaucoma in elderly people in particular. An appropriate awareness about glaucoma among the general public can help mitigate the problem of glaucoma-related irreversible blindness and its burden on the society. তোস্মিতা, তুমি যদি বাংলায় একটুখানি কিছু বলতে চাও তাহলে please go ahead. That once again we must emphasize about the need for awareness.
এক্স্যাক্টলি, ডক্টর বিশ্বাস খুব সুন্দরভাবে কনক্লুশন বলেছেন এবং আমি জাস্ট সামারাইজ করে এটাকে আরেকবার বলে দিই বাংলায় যে গ্লকোমা অ্যাকচুয়ালি গ্লকোমা একটা এজিং ডিজেনারেটিভ ডিসঅর্ডার, বয়সের সঙ্গে সঙ্গে এটা বাড়ে এবং এটা কিন্তু সেকেন্ড মোস্ট কমন কজ অফ ব্লাইন্ডনেস, এটা ইরিভার্সেবল। অনেকগুলো সিগনিফিকেন্ট ব্লাইন্ডনেসের কজের মধ্যে এটা কিন্তু মোস্ট ইম্পর্টেন্ট কজ এবং যেটা আর এর থেকে ভীষণ কিন্তু আর রেস্টোর করা যায় না। সুতরাং অ্যাওয়ারনেস কিন্তু খুব ইম্পর্টেন্ট এবং এটা আর্লি ডিটেকশন এবং আর্লি ট্রিটমেন্ট ইজ ভেরি 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 ইম্পর্টেন্ট। অ্যান্ড বাস এতটুকুই যে প্রত্যেক বছর এটাই বলার আলটিমেটলি যে প্রত্যেক বছর একবার করে অ্যাটলিস্ট যা যা রিস্ক ফ্যাক্টরস নিয়ে আমরা আগে আলোচনা করলাম, কজেস নিয়ে আগে আলোচনা করলাম, সেগুলোকে মাথায় রেখে অন্তত ইয়ারলি একবার চেক আপ করানো খুবই দরকার।
Correct. So with this, I would also like to remind our viewers, especially those viewers who live in and around Calcutta, that please get in touch with us for a complimentary glaucoma screening during the month of March, extending from 1st March until 31st March. Do avail of this opportunity and get a glaucoma screening done. All the best. I hope that all of you have good eyesight, and if at all any of you have the possibility of developing glaucoma, I hope that it is detected early enough to prevent permanent vision loss. With these words, today I put an end to today's discussion, and let me end this slide share, Toshmita, and I would like to remind our viewers. I would like to remind our viewers that this particular presentation or the patient awareness episode of Facebook Live shall be available on Facebook forever. So one can always go back and have a look at this. This particular presentation will also be uploaded to YouTube, and the YouTube page name is Netra Family Eye Care Center. All the past videos have been archived there, and they can be viewed there also. And not only that, I will for particularly today's awareness program, I will request our viewers and our well-wishers to circulate this presentation and today's message and the video among their friends and among their relatives, so that, as I said, by doing so, if we can prevent glaucoma-related blindness even in one person, that is a success. Right? Thank you, Toshmita, for being a support for this program week after week, and you have been doing a great job. Good job. Thank you.